So how good are border walls at keeping out pandemics? The World Health Organization officially branding the Ebola outbreak in eastern Congo a public health emergency of international concern. As the death toll from the rare strain climbs, so does the number of contact cases. Ituri province may seem remote on a map, but nowhere is very far in a globalized world. We'll ask about the outbreak and the lessons learned from previous pandemics. Since COVID, the United States has quit the UN's health body, the WHO. Public aid, science budgets, they're trending down among all G7 nations. What does that mean for the World Health Organization and for global health? Why is it that despite COVID, despite globalization, there's such a backlash against vaccines, cross-border cooperation, and more broadly, against science itself? Today in the France 24 debate, we're talking about the return of Ebola. With us from Kinshasa, Dr. Muhindo Mavoko, professor at the Department of Tropical Medicine at the University of Kinshasa. Thank you so much for joining us.
Thank you.
From Geneva, where she's attending the UN's annual World Health Assembly, Dr. Krutika Kupali, Associate Professor at the University of Texas Southwestern Medical Center. Welcome to the show.
Hi, thanks for having me.
Sociologist Bartholomew Konechny is Research Fellow at the French Political Science Institute, Sciences Po. You look at the impact of pandemics on the population more broadly. Thanks for being with us.
My pleasure.
On the go, by the way, you can listen to the show wherever podcasts are streamed. An outbreak in a war zone is always a recipe for disaster. Healthcare workers forced to play catch-up for an Ebola outbreak that was, well, flagged late, and as they face the challenge of screening locals displaced by armed groups. Charlotte Lamb has more.
Pulling into the eastern Congolese city of Bunia, cargo planes carrying emergency medical supplies as authorities and aid agencies ramp up efforts to contain the latest Ebola outbreak.
Actuellement, ce convoi-là, c'est 16 tonnes.
Currently, this convoy includes 16 tons of supplies to strengthen the prevention and control of infections.
Crates of protective gear, medical kits and emergency equipment unloaded on the tarmac. The outbreak is centred in 3 health zones across Ituri province, while one confirmed case has also been recorded in the city of Goma.
We ask above all that the population remains calm. The government, with all its partners, is working day and night to control this outbreak and to strengthen awareness within communities about the barrier measures.
The outbreak involves the rare Bundibugyo strain for which there is currently no approved vaccine, triggering tighter screening measures and border checks across the region. Health officials warn that insecurity and weak surveillance systems could hamper efforts to contain the virus. But there is some hope. 3 vaccines are currently being developed.
There is the first vaccine, as we said, the Ervebo-Merck vaccine. That is the one we're pushing the most, with some specificities we're studying. The second is the Chadox vaccine from the UK, and the third is the vaccine called VSV-BDBV. That comes from Texas.
This as a US citizen who contacted Ebola in the Democratic Republic of Congo arrived in Germany early Wednesday. The medical missionary will be treated in a special isolation ward at Berlin's Charity University Hospital.
And a second U.S. doctor is to be isolated in a hospital in Prague. Let me begin with you, Muhindo Mavoko. First off, there's still that, let's take it from the beginning, the search for what's known as patient zero. Explain to our viewers why it's important to first try to find where this this outbreak began.
Yes, when the Ebola outbreak begins, it is always important to figure out who was the very first case, and that can help to tell the story, the transmission channels, what were the occupation of the person, who did the person came into contact with, and that is very important to elaborate the contact tracing, which is very important in this case to understand and to cut down the transmission channels.
The WHO sounding the alarm that perhaps there's a couple of weeks late to flagging the beginning of the outbreak because of the fact that there is unrest in Ituri province. What more do we know about when we think the outbreak began?
Yeah, it is believed that the outbreak began a few weeks before the confirmation. One of the reasons being the insecurity in that area, which made it challenging to come to confirm the cases. So, for such diseases, it is very important to confirm the outbreak as early as possible, which helps to control. So the late it is detected, the more challenging it is to be contained. So that was a problem, among others, of the security in the region.
We saw at the beginning of that report the aid planes flying into Ituri's capital, Bunia. Tell us just right now, what are your needs on the ground? What have you assessed?
On the ground, as our Minister of Health said it, he made a call for solidarity. In this case, I think all stakeholders need to come together to assist. Some are doing it, and we are grateful for that. We need to provide protective equipment and communication tools, diagnostic tools. We need to bring diagnostic as close as possible because confirmation of cases is very, very important in such a situation.
Yeah, in the capital of Ituri province, Bunia, disinfectants that previously sold for the equivalent of around $1 US, 2,500 Congolese francs, now costing up to 10,000 Congolese francs. That gives perhaps an idea of how much people are scared. MSF says it's flagged suspected cases in nearby North Kivu province, as we can see from this map. Hippolyte Mouindo-Mavoko, tell us about Ituri province and the challenges of fighting an outbreak in that area.
Yes, the province is, as you said it in the beginning, has security challenges in some areas. So, which will make not very easy for the healthcare workers to move around and identify the suspect cases and the contact cases. But I believe now the security agenda will be pushed as well so that healthcare workers can be free to circulate. And there are some speculations, people being afraid, but it is very important that people calm down, no panic, so that they don't take a bad attitude that could put them more in danger. It is very important to stay calm and trust the national health system that is led by the Ministry of Health.
Have you been in contact personally with people in Bunia? Have you been talking with them?
I talked to some colleagues who are there on the field. They are doing their best to initiate the response. They are working hard. It is very important to remind that the DRC has experience in the management of such situation. This being the 17th time we have such an outbreak. So it is very important that there is a good collaboration between the community and the the healthcare system, and to strengthen the trust and the authorities who are doing their best together with stakeholders to solve the issues.
Krutika Kupali, a lot to unpack in what Hippolyte Mouindo-Mavoko has just told us. First of all, your reaction to that lost time, those couple of weeks where the outbreak had not yet been flagged.
Yeah, no, that's very concerning. We can tell that the outbreak's been going on for quite a while, just based on the number of cases that were announced last week when the declaration of the outbreak was made. And already, today, WHO in their press conference said there's over 600 suspected cases. So you can do the math backwards based on the incubation period of this infection and figure out that this has been going on for a number of weeks undetected.
And how do you make up for lost time?
So it's going to be really important to do a number of the things that were already discussed. I think really working on identifying cases, making sure we're doing good surveillance, making sure we're doing good contact tracing, that we're engaging communities so they understand what is going on, but also working to develop trust. I also think it's going to be really important to scale up diagnostics so we can make sure to adequately test people and make sure we're optimally providing supportive care for them. So it's not just one thing, it's going to be a number of things that we need to do in order to contain this outbreak going forward.
What do you mean by working to develop trust?
Yeah, so this isn't an area that has had a lot of unrest, right? So they have violence, they have had been plagued by violence. And then on top of that, you have people who maybe don't understand what Ebola is. They don't understand how significant it is. And I also think that, when these things happen, you have an influx of aid. So you see people coming in to do things, but then just as quickly as we come in, when things get better, people leave. And so, and that also helps build mistrust in the community. So it's really like making people understand that we are there for them, we want to help them, and that the help is not just going to be there for the time of this outbreak, it's going to be sustained. And you want people to trust that people are there to really help them.
So who runs traffic?
You mean who coordinates the response?
Yeah, who coordinates the response in order to build the trust that you describe?
Yeah, I think it's all the agencies that are involved. You can't just put it on one agency, right? So you have the major players already, WHO, Africa CDC, the ministries of health, the NGOs like MSF, right? We all need to work together in order to develop plans to reach out to communities. Another way to build trust is also engaging leaders that are trusted in the community to try and help them reach out to people. That is always an effective way of building trust with other members of the community. So lots of different ways to do it, and we all need to be working together to have one response so it is effective.
Krutika Kupali, we saw at the beginning in that report a clip from the African body there, the Africa CDC, where they talked about perhaps the potential for these vaccines. They named 3 of them. Your thoughts on whether or not that's a route that can be followed? This is a rare strain of Ebola and one without a known proven vaccine.
Yeah, so I don't think we're going to have a vaccine in the next, few months. It's going to take a while. The 2 that they mentioned that are in development for Bundibugyo, they're in different phases of regulatory development, and so that will take a while. The other vaccine, the Arivo vaccine, has been approved for Zaire strain, which is about 40% genetically different than Bundibugyo. And I think that there has been some discussion that it could be effective. I think that there needs to be a lot of thought about whether or not that will be used because, number one, we don't want people getting vaccinated thinking that they have protection and not having protection. That would be a really big way to not have people trust us. And so we don't want that to happen. And I think there's ethical implications of that as well. I also think that, we want to make sure that people would understand what that meant to get a vaccine that we don't have that kind of information on yet. So I think there are a lot of things to think about as we move forward with trying to develop medical countermeasures. But initially, really what we need to do are the things that I've already mentioned: contact tracing, surveillance, making sure that we're doing good diagnostics, and then really anybody who's sick, getting them optimal supportive care. Lots of data has shown that that's going to be very important in preventing deaths.
Yeah, this element of trust, let me bring you in on this, Bartholomew Konechny, which is key for all the stakeholders to be able to try to contain this deadly outbreak. Your thoughts on how it's going so far, and what more can be done on that level?
So I think the first thing to say is that it's very hard to make an untrusting person a trusting person, right? And so what we need to focus on in these kind of situations is not necessarily changing people's philosophical outlook on life, but recruiting leaders in those communities to advocate for these important causes. I think you and I and the people coming in from outside, we will never be able to fully persuade people quite as effectively as those that populations already know and have a relationship with.
So that's element one. Hippolyte Mouindo Mavoko, there was something important there said by Krutika Kupali, which is if the local population sees suddenly all this attention, and as you mentioned, there have been 16 previous outbreaks of Ebola, and then suddenly, and then once the initial danger is gone, they all leave. What does that do?
Yes, that's a fact, and it is there is always a combination of teams coming out and local staff. It is very important to involve the local healthcare workers. And regarding the building trusts, it is important also to involve local opinion leaders. And now there is an aspect that we need to take into the account is how to manage social media. That the messages are circulating, infodemia, and so on. So those are aspects that are needed to be controlled and allow people to receive the good message. Because when there is no communication, anything can circulate, and it will make people being afraid. I would like also to draw attention on the media. When you put an emphasis on the fact that there is no approved vaccine, I think that may help also to increase the panic. It is not because there is no approved vaccine that the outbreak cannot be controlled. There has been outbreaks controlled without. Of course, vaccines are important, additional tools, very, very important, but not having approved vaccine is not such dramatic that we need to all panic.
But you heard Krutika Kupali say that there is this risk if you roll out a vaccine that's not very effective, it could be even worse. Do you agree with her on that?
Yes, it all depends on the accompanying communication. It is important. For example, we have conducted Ebola vaccine trials here in the country, and we kept reminding the participants that although you are vaccinated, it does not mean 100% you are protected. So if an outbreak occurs in the area, you still have to use protective measures. That is very important to give as a message.
Krutika Kupali, you agree with that?
I mean, I definitely agree that when you're giving vaccines, you need to give the message that it may not be 100% effective. I think the question that is still unclear is if the Arivo vaccine, what kind of protection, if any, it has against this particular species of Ebola, because it is very genetically different. So I think that would be an important thing to understand. And I think, there really needs to be a good debate about, what kind of role there was going to be if they're going to do that, and the ethics behind doing that. I think that is a very important thing to think about. And again, I think given where we are with the outbreak right now, I think that really we need to be focusing on the things that we discussed earlier, such as contact tracing, making sure we're getting people diagnosed, making sure they're receiving optimal supportive care. I ran an Ebola treatment center in the 2014 outbreak, and we didn't have therapeutics, we didn't have vaccines, and as was already mentioned, we can get this outbreak under control using the tools we have. And so I think we want to make sure that we're using those as well as possible before we add in other tools that may not be as efficacious.
So, Kritika, for those who failed science classes like myself, just explain here something, which is during COVID, we saw this record rollout of vaccines. Why is it not always the case?
Yeah, so during COVID, one of the reasons we were able to roll out the vaccine so quickly is, number one, really the whole world was working on COVID, right? That's the first thing. Number two, we were able to do multiple phases of the study concurrently. So we were able to get those done quicker. So then we were able to get a vaccine approved. This is a situation that's very different. This is an infectious disease outbreak that's having in a different part of the world. And unfortunately, we need more political will and more manpower to work on the vaccines for these diseases. And it's just a very different situation than it was during COVID.
So, Bartholomew Konechny, you heard Hippolyte mentioning that this battle's going to be won perhaps not with traditional media like here, but a lot on social media. So how do you get that message across effectively?
Yeah, so I think there's a few dimensions we need to consider about this. The first is that we know social media is now not just a platform for citizens to debate, but there are lots of state actors involved in social media. So I think what we need to be watching out for is not just our individuals sharing conspiracy theories about Ebola or spreading disinformation about a future vaccine, but we also need to be concerned about the fact that countries like Russia and China, they have their eyes set politically on Africa. And I think they have in the past shown no inhibitions about using crisis as a way to spread disinformation, particularly against the West. And so we need to see this, yes, as a battle to get the good information out there. Yes, as a battle for people to take up good and important behaviors. But we also need to think about this in the broader context of a misinformation environment where we know that there are state actors who are feeding in conspiracy theories.
Feeding in conspiracy theories. And again, how much has that changed since the COVID pandemic? Because there was social media back then.
Well, I think we're now fairly confident that, particularly in the case of Russia, that there are people on social media affiliated with the Russian state who have fed misinformation about COVID vaccines on social media. So in a sense, the COVID crisis was the beginning of that frontier in international politics, right? And I wouldn't be at all surprised if Ebola and also hantavirus are a continuation of that kind of conflict online.
Hippolyte Mohindo Mavoko, how do you get your message across also if you're going to be broadcasting it in local languages, because they speak several languages in the east of Congo?
Yes, in local languages, but we have in the country 4 national languages, and in that area at least 2 Lingala and Swahili people in that region understand. So the messages, if they are communicated in those local languages, the people will be able to understand.
Yeah, and that brings us to this question of how people view now a pandemic or view an outbreak compared to before. We saw this recent hantavirus outbreak aboard a cruise ship suspected to have originated in Argentina. And already, this was just a few weeks ago, people were drawing attention to the fact that Buenos Aires is leaving the World Health Organization, that its disease prevention budget has been slashed. It's strange times, Cressida Kupali, to be attending that annual assembly of the WHO in Geneva. It's all happening at the same time. What's been the mood where you are?
Yeah, I mean, I think people are very concerned about what's going on. I think that people are worried about the outbreak in DRC. I think there's still worry about the hantavirus outbreak. I think that what this shows us is what we've been talking about for years, is that we really need to invest in preparedness and response. And we need to invest not just when there's a crisis, but also during times when there isn't a crisis. So we can have resilient health systems, we can have a prepared workforce, so we can respond to these things early and quickly so they don't become out of control.
The Bloomberg News Agency reporting that back in 2016, under the Obama administration, funding for a hantavirus vaccine research was scrapped in the United States due to lack of funds. Bloomberg, which highlights continued public distrust in the Center for Disease Control, the CDC, that's the big U.S. body that oversees this sort of thing, which currently has no permanent director. So budget cuts are not new to this administration, Cressida Kupali, but how does this time feel different?
Well, I think that the budget cuts are concerning because, in addition, there's been the defunding of USAID, which typically would have helped with some of the infrastructure that we need to help respond to these responses. So we don't have that infrastructure anymore. CDC has also lost a lot of their leadership, and so we don't have that institutional knowledge to try and help with the response. So I think there are a lot of things that have happened in this, the last year that really are making this response much more complicated than it would have been previously.
The U.S. State Department stating that it's sending aid. It's also going to help try to set up local field hospitals. But it's doing it kind of on a country-to-country basis. What's the role of the World Health Organization? Is the U.S. way of doing it also good?
Yeah, I mean, as we saw recently with the hantavirus outbreak, and we're seeing with this outbreak, you need a global coordinating body. And I think both of these outbreaks have actually reinforced the importance of having WHO. And so I do think that, once you have people kind of doing their own things, it actually can make things a little bit more confusing. So I think that having WHO working with the partners to coordinate the response, working with the ministries of health, because it should be country-led, and to try and develop a plan to contain the outbreak.
Hippolyte Mohindo-Mavoko, does this time feel different than others? You're in front of a health emergency in Ituri province. Does this feel any different than before on that score, what we're talking about here, which is international coordination? Does it matter?
Yes, it is different, and the health system not being well supported as it used to be in the previous time, with the WHO having enough resources for surveillance and so on. Maybe we could have a different figure if that did not occur. And it is important to note down that when different countries are putting resources in one basket for the global health, it is not to be considered only as a donation, but it is also important for everybody's security. You see, if I go to my neighbor helping him or her to kill a fire, I'm helping, of course, but I'm also protecting myself so that that fire does not move to my place. That is important also to take into the account.
And you know, again, it's this question of what's changed or not. Bartholomew Konechny, the World Health Organization, it came in for criticism during the COVID pandemic. Particularly, you were mentioning China earlier for being too soft on China and the search for patient zero there at the time. But what do your studies show in terms of the attitudes towards this, you know, this supranational body, the United Nations?
So I think the first thing that's really interesting is that earlier this week, when Trump was asked about Ebola and why isn't he participating with the WHO, the first thing he brought up was the Wuhan lab conspiracy. And I think what that speaks to is the fact that it is pretty popular at the moment in high-income countries to give international organizations a bit of a kicking. Not because of anything the WHO has done, but because we're living in a moment where large chunks of the population view international organizations as the problem. And so if you're Donald Trump, if you're Javier Milei, if you're a populist leader in any country, organizations like the WHO are a really easy target for you to kind of rally your base a bit and get more popular. So I don't think we should look at their lack of participation as a part of any sort of broader public health strategy.
Does it make
it's a political strategy.
Why does it make you more popular?
Why does it make you more popular? I think because people across the Western world have been living in an environment where they've been constantly told for the last 20, 30 years, oh, we must participate in international organizations, it's going to make us richer and better off, and people don't feel that way, and so they end up attributing blame to all international organizations. Now, I'm not saying that that is the right attribution of blame, but, you know, certainly it's the case that, you know, a large proportion of voters in Europe and North America, by the way, this is not just a North American problem, really believe that things like COVID were a conspiracy organized by governments with the participation of international organizations. So about 25%, both in North America and Europe.
All right, so last September, we saw the U.S. president launch into a surprise outburst against, well, first Tylenol, which is the most popular brand of paracetamol pain relief in the U.S. By the same token, Donald Trump having a go at vaccines.
There are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none.
All right, that's his health secretary, Robert Kennedy Jr. By the way, Donald Trump contradicted by his own director of the National Institutes of Health in Senate testimony back in February.
I do not believe that the measles vaccine causes autism.
No, I didn't ask measles. Do vaccines cause autism?
I have not seen a study that suggests any single vaccine causes autism.
So, Kratita Kupali, please explain to us, what is it about these rumors about vaccines and this distrust of the scientific community more broadly? How do you attribute it? What's this all about?
Well, I think part of the distrust right now is that, you know, this has been going on for a while. There's always been a discourse about vaccines. And we have people like our current health secretary who really do peddle misinformation. They've done a lot to discredit the regulatory bodies in our country and the advisory committees in our country. Listen, there's no data, there's no scientific data that says that vaccines are linked to autism. It's just not true. But the problem is that we have a system right now in the United States where our leaders are spreading this kind of misinformation by doing things to undermine the bodies that have already been there. That's number one. Number two, right, they contradict themselves all the time. So this whole Tylenol causes autism. There's data that shows that Tylenol does not cause autism. And it's actually very concerning that they would even say that, because pregnant women, that really is the only pain medicine that they can take. So now you have pregnant women who maybe heard this coming from our health secretary and our president, and they're going to be scared to take that medicine. So, you know, these are the types of things that are happening in the United States right now that are very concerning and continue to sow doubt in people's minds, people who maybe don't know how to evaluate the scientific evidence.
If they're doing it, it's because they're getting political traction out of it. Why are they getting political traction?
Sure. Yeah, I mean, I think that's a great question. They are getting political traction out of it, but they're getting political traction out of numerous things, right? It's not just one thing. It's the combination of what they're doing, right? They've used this word expert. That word expert has become weaponized in the United States. And they go back to COVID, right? They go back to COVID saying the experts got it wrong. The experts this, the experts that. And they're, saying, listen to us. We know better. But that's not true. And so I think, again, going back to what was said earlier, right, there's this sense that the people who do have the expertise, the scientific scientists, right, that, they don't know what they're talking about. And they use that to move themselves forward.
So a war on experts, Bartholomew.
I think it's not unreasonable to say that there is a war on experts going on in the US at the moment. Why?
It's not just the US, is it?
It's not just the US.
We saw it here in France. There was a doctor during COVID who gained a lot of traction because he had a theory that went against the grain, and he became kind of a cult hero at the time.
Well, I think that was a very particular situation, and I think Didier Raoult's story is. I mean, there are many questions around the ethics of his research as well that I think are kind of complicating a bit that situation. I will say that I think in Europe there are kind of very deep research cuts, as in the US, although they have less of a political tinge to them. But why is it that the Trump administration and other populists pursue really this war against scientists and a kind of empirical form of knowledge? I think that is part of their appeal, right? I think a lot of people feel that they're constantly being told they're in the wrong by doctors, by experts, that if they just took this medicine, they'd be better. And I think the appeal of Trump to many of his voters is that he shoots from the hip and says something completely mad, which they probably don't believe. But the style of saying it is attractive to them. It's his willingness to be this kind of macho character.
But we've had the end result has been we've seen measles outbreaks.
Oh, the end result is terrible. Absolutely. I totally agree with you. And I think that's why the advocates of public health have to be much better communicators. So I think people who work in public health often communicate in a way which they like and which other people in public health like, but we're not good at convincing the skeptics, actually.
So, Hippolyte Mouindo-Mavoko, by the way, it's not just the United States. There was a survey from the London School of Hygiene and Tropical Medicine that monitors global trust in immunization programs. It's seen a steep increase in vaccine skepticism in South America, in Japan, in South Korea, Russia, where it was already low. By the way, the Democratic Republic of Congo, one of the countries where trust in vaccines has actually gone up. How do you explain that?
Yes, I think we explained that maybe in the Western world, like for the measles, for example, the children get the vaccine, but people are not aware of the disease. But here, in contrast, we have sometimes outbreaks of measles. We recently had an outbreak with mpox. So people see the disease. They understand it more easily. That's why they are more willing to get such vaccine. There were problems with COVID vaccines because of a lot of stories that was told. But I think it is scientists should be more and more communicative, because sometimes when we communicate among us in a language that only ourselves can understand, the community has nothing to do with that. I think it is important to start communicating, telling the community the evidence-based and the rationale for this intervention and that in a language that they are able to understand. That may help them not being manipulated by those that do not master the science.
So, Hippolyte, I know that in Africa you always have had, over the last decades, this three-way competition between Western medicine, traditional medicine, and Chinese medicine. Here, we're talking about something completely different, which is pro and anti-science. How do you make sense of it yourself?
Can you come again, please?
How do you make sense of the fact that there is this sort of backlash against science in part of the G7 countries?
Yeah, here we see that in several cases for the when we assess the health-seeking behavior, we have the modern medicine, but traditional medicine and also religion. Some people go also to church for disease before going to the hospital, meaning that in the communication, it is important also to take all that trajectory into the account and all those stakeholders, to involve them also to explain the importance of this and that intervention, so that the population can comply to what the Ministry of Health is asking or is recommending.
Can science make a comeback? I'll put it to you, Bartholomew Konechny.
Oh, absolutely. And it has done many times throughout history. I think we often feel ourselves to be living in a unique moment of conspiracy and populism. But I would say to you, if you look at the course of human history, if you look at pandemics in the past, they are petri dishes for these kind of conditions to emerge. And I think every time science and empirical evidence comes back stronger, mostly because it works.
Okay. That'll be the closing argument. Bartholomew Konechny, I want to thank you. I want to thank Kritika Kopali for joining us from Geneva. Hippolyte Muindo Mavoko for being with us from Kinshasa. Thank you for being with us here in the France 24 debate.